Today, we're going to talk about Lyme disease in dogs. Lyme disease is caused by Borrelia burgdorferi, a spiral-shaped bacterium carried mainly by Ixodes ticks, like the black-legged deer tick. The tick usually has to stay attached for a while before transmission happens, which is why tick prevention and quick tick removal are so important. In dogs, Lyme disease does not always mean obvious sickness. A lot of dogs test positive because they were exposed, but they may never show clinical signs. When dogs do get sick, the classic presentation is a dog that suddenly becomes painful, feverish, lethargic, and lame, and the lameness may shift from one leg to another because the joints are inflamed. Diagnosis usually starts with tick exposure, clinical signs, and a positive antibody test, such as a SNAP test or C6-based test. A C6-based test looks for antibodies against the C6 peptide, a Borrelia burgdorferi antigen associated with natural exposure rather than Lyme vaccination. But a positive test alone does not prove Lyme disease is causing the current problem, so the veterinarian has to look at the whole patient. One major thing to check is the urine, because Lyme disease can rarely be associated with Lyme nephritis, where immune complex damage causes protein loss through the kidneys. Treatment for a clinically affected dog is usually doxycycline, commonly around 10 mg per kilogram by mouth once daily for about 30 days. If the dog is painful from Lyme-associated joint inflammation, a veterinarian may also use a dog-safe NSAID, such as carprofen, daracoxib, firocoxib, meloxicam, or grapaprin. But this is where the urine and kidney values really matter, because if the dog is dehydrated, azotemic, proteinuric, or suspected to have Lyme nephritis, NSAIDs may be risky. Prevention is still the best medicine. Consistent tick control, checking the dog after outdoor exposure, and Lyme vaccination for at-risk dogs in endemic areas. So the big takeaway is, Lyme disease in dogs is not just positive test equals sick dog. It is a tick-borne Borrelia infection where joint pain, doxycycline, urine protein, kidney safety, and prevention all matter.